Hey guys, today is November the 14th, Wednesday, 2013. We are doing the long bone dissection. This is a pork bone. This is the superior part closest to the pelvic area. This is the inferior part closest to the foot. We have the proximal epiphysis. We have the distal epiphysis. These two nub ends here are the epiphysis and the articular cartilage. These are the stubby ends. This is usually where the hyaline cartilage is. Now, people usually, when they cut in, they think that this is the bone, but this is actually the cartilage. In the shaft, we have the main part, which is the diaphysis. The diaphysis houses the marrow cavity. The marrow cavity is also known as the medullary cavity. This houses also the bone marrow. We have closest to the proximal is the red bone marrow, which houses white blood cells, red blood cells, and platelets. In the middle part here in the diaphysis, we have the yellow bone marrow, which is also covering some blood vessels. That's why it's not yellow, it's pink because it's full of blood. Around the bone here in the shaft, we have a dense connective tissue called the perosteum. Now, within this perosteum and within the bone, we have the cancellous bone here. And then we have the compact bone, which is here. Now, within this, we're also going to see the epiphyseal plate, which is usually closest to the proximal epiphysis or epiphyseal. It's up here. Now let's talk about the joints. Since we're on this video, we have the hyaline cartilage here. We have the meniscus here. Now this meniscus is also covered, like this whole area is the joint area, the knee joint, and the articular cartilage area also. It's covered by a synovial membrane, and within the synovial membrane is synovial fluid, which is usually in here. It's kind of dried up a little bit, but it's like oil. Again, this is the meniscus, and here on this one, it's easier to see. This is the ligament that connects the two bones together. This is also known in the book as interosseous ligament. And then we have the joint capsule, which is this whole thing all together, which is protective. So the purpose of this, all this stuff here with the hyaline cartilage, the synovial membrane, and the synovial fluid is for easy movement and smooth movement, and without it, we would be crushing our bones. It's like a shock absorber. This concludes our dissection today. I hope you guys enjoyed it. Thank you.